Hi. Welcome to the Invisible channel. We are here to support people living with invisible illnesses, by sharing everyday wellness and caregiving to each other through our videos. Make sure to keep motivated every day, treat yourself kindly, and stand up for yourself. Today, we are going to talk about chronic fatigue, and chronic fatigue syndrome. How is it like, and also the differences? Be sure to watch this video to get better understanding on the topic. Chronic fatigue is one of the symptoms of chronic illnesses such as fibromyalgia, rheumatoid arthritis, lupus, etc. It is a condition of lack physical or mental energy, inability to stay awake and alert or initiate activity. Getting out of bed can be a struggle for many, especially if you're dealing with chronic pain, fatigue, anxiety and disruptive sleep. There could be many possible causes for those symptoms, and among them are mysterious, debilitating conditions like fibromyalgia and chronic fatigue syndrome. People who have either condition may experience many of the same symptoms, and it can be hard to pinpoint exactly which condition they may have. However, chronic fatigue syndrome or CFS is a long-term illness with a wide range of symptoms. The most common symptom is extreme tiredness. CFS is also known as ME, which stands for myalgic encephalomyelitis. Many people refer to the condition as CFS/ME. Everyone feels fatigued sometimes, and many people feel fatigued a lot of the time. But, chronic fatigue syndrome isn't just being tired. It's a new state of fatigue that has lasted for at least 6 months, and that can be so severe that it gets in the way of your normal daily activities, at home and at work. Apart from fatigue, there are some other CFS symptoms such as severe headache, loss of memory or concentration, sleeping problem, muscle pain, and sore throat. Chronic pain and fatigue are common symptoms of both fibromyalgia and chronic fatigue syndrome. The difference is that, in fibromyalgia, fatigue often takes a backseat to debilitating muscle pain. In chronic fatigue syndrome, people have an overwhelming lack of energy, but also can experience some pain. Chronic fatigue syndrome and fibromyalgia are so similar that some doctors believe they are the same condition. Others consider the two conditions related. The syndrome is well named. The exhaustion associated with the condition can be debilitating and may last for years. The cause of chronic fatigue syndrome is still unknown, although there are many theories, ranging from viral infections to psychological stress. Some experts believe chronic fatigue syndrome might be triggered by a combination of factors. It may worsen with physical and mental activity, but doesn't improve with rest. There's no single test to confirm a diagnosis of chronic fatigue syndrome. It may need a variety of medical tests to rule out other health problems that have similar symptoms. There are also clear guidelines to help doctors diagnose the condition. The patients might have CFS for short or long term. Overall, there is wide variation in the duration of illness, with some people recovering in less than 2 years while others remain ill after several decades. Those who have been affected for several years seem less likely to recover, Full recovery after symptoms persist for more than 5 years is rare. To get some relief of CFS, patients can get medications and also by doing variety of therapies. When it comes to non-pharmacological help, doctors use a variety of tools like counseling or suggesting support groups too. Physical activity is also crucial in staying healthy and helping treat both conditions. It's important to stay active, but remember to always pace yourself. Set a structured activity program that avoids overexertion and reach out to your doctor for help in putting together an activity program. Family support plays a huge role too. Spending time with family member with CFS, be it in good days or bad days, can contribute to patient's recovery. If you're suffering with chronic pain, talk to your doctor. A diagnosis can put you in a better position to manage your symptoms, even if there are still some mysteries surrounding your disease.